We're particularly concerned about the increase throughout our communities. This pandemic is not slowing down. Instead, if anything, it has sped up. In just a couple of months, Delta variant has ravaged our state. It has preyed particularly on those who are unvaccinated. Those unvaccinated persons, unfortunately, have largely driven our cases and our hospitalizations. We know Delta is markedly more transmissible, and that has led to what we are seeing across our communities across Washington. I think the key message is that this pandemic rages on. Hospitals are absolutely stressed and strained, largely due to the weight of the unvaccinated, but now we're also seeing additional persons that are being admitted and or in the hospital and testing positive, even if they're asymptomatic or mildly symptomatic. With respect to our hospitals and healthcare system, situation has certainly worsened statewide. And I'll use the 3 S's here. The system is stressed, it's stretched, and strained. And the 4th S is we must support those very systems. Not only have COVID-related care been on top of what else has been happening in our healthcare system, either deferred care or people that are going there for another reason, like a heart attack or an injury, but staff shortages are a real concern, and that is something that's concerning to all of us. That means that staff beds and overall the system capacity is absolutely an issue, and we are concerned about that as well. So what does that mean? That means we all must do our part so things do not get worse. We want to make sure that people are wearing their masks and getting vaccinated and avoiding situations such as crowded settings that may be of concern. If we can show the map of what's happening in across Washington with hospitalizations, I'd like to show that now. So as you see this map, and this is on our website, please refer to it, you're seeing that you've had a strain and increase across the system, particularly that is in the setting of what's happening in our larger communities, but this is now also happening in our critical access hospitals in rural communities, smaller communities. The system is absolutely stretched. Like I said, it's stressed, stretched, and strained, and that support means that people, all of us, have to do our part to wear our masks, get vaccinated, and avoid crowded settings and situations that might lead us to have COVID-19 on top of everything else